Now, COVID has highlighted the need for economic support, affordable housing, and other equity-focused investments in low-income neighborhoods throughout our state. An exacerbation of these social risks underscores the critical need for us to reframe domestic and intimate partner violence in terms of structural and social determinants. Now is the time to highlight how primary prevention investments can protect and support families and neighborhoods impacted by violence. Today, the California Initiative for Health Equity and Action brings together UC faculty, advocates, and policymakers to present evidence about how social risks can impact domestic and intimate partner violence. And through this collaborative effort, we aim to advance prevention programs and policies as a way to prevent violence in the first place. We look forward to your engagement in our discussion, and we are so grateful for the support of Blue Shield of California Foundation, our sponsors of this event, as well as the Office of Senator Melissa Hurtado. Now, a couple of housekeeping items. Please use the Q&A functions to submit questions that you have for the panelists. Submitting your questions allows everybody on the call to see this. We also encourage you to use the chat function today for any general reactions or comments that come up during the briefing. You can talk to one another. Everybody can see these messages, or you can do just to all panelists and all attendees. We encourage your engagement. It is my pleasure to introduce the lead-off guest speakers for this event, Senator Melissa Hurtado and Dr. Aaron Kerrison. Senator Melissa Hurtado represents California's 14th Senate District, which encompasses parts of the Southern Central Valley. Prior to being elected to the state Senate, she served on the Sanger City Council, and she's been an advocate for health access, quality schools, good paying jobs, and opportunities for a better life. She also worked as a community organizer for public employees, where she helped lead the fight for good wages, healthcare coverage, and retirement security, and she currently serves on the Senate Health Committee. It is also my pleasure to introduce you to Dr. Aaron Kerrison, a professor in social welfare at UC Berkeley, who is an expert focused on the impact of structural disadvantage, concentrated poverty, and state supervision on service delivery, substance abuse, violence, and other health outcomes for individuals and communities marked by criminal justice intervention. Thank you so much, Dr. Kerrison and Senator Melissa Hurtado, for kicking off our event today.
Good. Okay. Good afternoon, everyone. I promise to yield the mic when the senator can join us, but in the meantime, I want to introduce you and welcome you, and thank you for joining us. My name is Aaron Kerrison. I'm an assistant professor in the School of Social Welfare, and I love working with Kalahia. I'll tell you a little bit about the team and the work that we're doing and the relationships that we're building, and a bit about what we want to talk to you about this afternoon. So Kalahia, as Dr. Rodriguez mentioned, is the California Initiative for Health Equity and Action, and that brings together faculty from the Cal State University system, as well as the University of California system, and partners, those of us, who are really committed to action research, research that will be applied and implemented and can improve outcomes for all the folks that we're working on behalf. Kalahia pairs us with legislators and policymakers and practitioners, who are really 10 toes down doing this work and doing it alongside scientists. So it's a really, really exciting sort of movement to be a part of, and I'm always honored to join the team. So thank you guys for that. I'll say a bit about what I do, which all of my work is grounded in legal epidemiology. And we're hearing epidemiology all over the place. We might be ignoring epidemiologists, but they're right. I'm sure you've heard these words before, studying the spread of injury and disease. And so my work, which is legal epidemiology, springs from this understanding that there's a clear and direct line between the law, how it's written, how it's enforced, who's left out, all these kinds of things, legal processes, legal institutions. There's a pretty bold and straight line from those sorts of structural practices and influences and the health outcomes we see by everybody sort of in its wake, if you will. And I focus specifically on the criminal legal system, but that doesn't exist in a silo, right? criminal justice work and policy is connected to gender violence. It's connected to housing insecurity. It's absolutely connected to poor education systems, all these kinds of macro, structural, or upstream determinants of health. They all work together and they overlap in ways that are pretty sinister, but also that means it's going to take a multi-pronged effort to dismantle them. So I'm really, really excited to introduce you to our panelists today who know all about it and have all the answers. So no pressure, guys. We got to get this done in an hour. She's able to make it, but in the interim, I'm going to introduce Dr. Anita Raj, who is a professor of infectious disease and global public health, at the School of Medicine. The School of Medicine at the University of California, San Diego. So she's going to speak for a few minutes about the work that she's doing with respect to the upstream determinants of community and domestic violence. Dr. Raj?
Thank you. So I am part of a team that works on a project we call CalVEX, which is the California Violence Experiences Across the Lifespan. And this is a survey. Okay, so I'll try to go a little slower, but move through the data. So we find that about 1 in 4 women in California and about, I think it's about 8% of men have experienced physical or sexual violence from an intimate partner. So this is a very narrow definition, and it's the tip of the iceberg of violence experiences from partners. But importantly, we see disproportionate effects for women. We also see that women are experiencing this at the hands of gun violence. About 13% of the women who have experienced partner violence have been threatened or had a gun used against them. That is not the only difference we see. For men, we see that those who are sexual minorities, specifically gay or bisexual or other identifying, were more likely to have experienced intimate partner violence. And with regard to race ethnicity, we see that Black women are disproportionately affected. More than 1 in 3 Black women has experienced intimate partner violence. Next slide. So the other thing that we want to highlight is that the issues that we see certainly are tied to issues of gender inequality, but they're also tied to these racial disparities, which are again linked to what we call social structural risks. We find that if you have a disability, for both males and females, you're more likely to experience partner violence. And then I really want to highlight points that were already made, that homelessness and incarceration histories are very much tied to vulnerability, increasing risk for women and men. But you can see that over half of women with a history of homelessness and over half of women with a history of incarceration have experienced this violence. Overall, what this means is that we have over 3 million women and 700,000 men in our state affected by this issue. We also know that we have racial, ethnic, and social disparities that are likely contributing to vulnerabilities. And so the importance of social solutions is quite relevant and will hopefully be a focus of the conversation. And we have to also recognize that fewer than 1 in 5 people who have been affected by any form of violence ever report this formally or use criminal justice services. So our reliance on carceral responses is not only problematic for many of the reasons others will discuss, but it's also not useful.
Thank you so much for that, Anita. Thanks everyone for hanging in there. We will have the slides available. Dr. Raj is very graciously offered to answer questions, so hopefully we can fill in the gaps that you all might have missed following all the panelists' insights. So thank you again. Hello, Senator Hurtado. Please, welcome. Thank you for joining us. We're gonna cut to you then, okay? I'm gonna go on mute.
And I always joke that, even though I am a millennial, I still don't know how to work Zoom. And so I apologize for the challenges today, but I'm very excited and happy to be here with you today. I wish you could see me, but at minimum, I wanted to be able to, provide some opening remarks, but now it's midway remarks. I apologize for that. once again, but thank you all for joining in on this important conversation. COVID has impacted so many lives, not just here in California, not just in my Senate district, but across the entire nation. And the work that has been done and the work that needs to continue on, the impacts of COVID are going to be lingering here for a very, very long time. And particularly around, sexual assault and just a couple of weeks ago, I was out in the field work in the fields, talking to farm workers, and I had this young woman come up to me and just tell me how scared she was that her former partner was making every effort to try to kill her. And, that obviously concerned me, and I provided her with my contact information. And thereafter, she continued to message me. Her former partner went to the point where he went to her home and tried to kill her. Luckily, he wasn't able to. He was, arrested and put in jail, but then was released due to COVID in the county jails. And when she learned of that, she called me once again out of fear and just said, I don't know what to do. Obviously she doesn't speak any English. She just speaks Spanish. She was crying. She just said, I'm going right now as I speak to you. I'm going to go purchase a gun because I need to go find a way to protect myself. And I said that, that I would work with her and that I wanted her to, if there's anything that I could do. I mean, I even offered, I said, I'm going back to Sacramento for a few days. If you want, if that makes you feel safe, you're more than welcome to come with me. I'd be happy to provide you with, hotel, a room to stay in, because my fear and her fear was that he was going to come back into her home, try to kill her, and that she would have to defend herself. And that would be seen, and that she would put herself in a situation where she no longer was the victim and now was the perpetrator. And this is just one person that I came across during this time. And it's something that already existed in our communities, and something that, we got to really find a balance to make sure that there's true justice for everyone. And, it's a reminder of the work that needs to be done. And I know I did, put together some policy legislation earlier this year that didn't make its way through. To be able to provide, victims of sexual assault with, additional protection. But, what I've learned in my role as state senator is that when you feel passionate, and I could go on and talk for a while, but what I want to leave you with is that in my experience as state senator is that, sometimes, there is legislation that you feel very excited and strong and passionate about, and that you're moving forward with it to make a difference in the lives of many that are struggling, especially now during COVID. But there's a lot of positive things that we can do in the lives of individuals that are struggling, and we have to look beyond legislation, connect with people, and be able to make a difference. And we can make a difference, legislation or not. We will make every effort to make a difference in the lives of the people that need it the most. And so I really appreciate you all coming together and on a very important topic of community violence in the era of COVID-19. And happy to be here as an ally, as a partner in any future endeavors. And I strongly and firmly believe that a lot of it is preventative. I'm a firm believer in that. And so anything that I can do on my end to be supportive to you in this important topic, happy to help. But thank you so much for allowing me to provide the opening remarks. And I also thank the organizers and the panelists that are on this Zoom call today. Thank you.
Thank you so much for that, Senartha. We're really, really happy that you were able to join us. And thank you for lifting up that woman. You know, we spend a lot of time dealing in data, if you will, and it's really important to remember that behind every single one of those points is a person, and one who is deserving of our attention and respect and safety. So thank you for sharing that, and thank you for all of the work that you're doing on behalf of your district and all of us here in California. So we're gonna segue. Sorry, I lied. Mike, sit tight. We are instead going to shift gears and hear from Kanwarpal Dhaliwal, who is the co-founder and associate director of the RISE Center here in Richmond, actually. I'm beaming down to you from Richmond, California, also unceded Huichinolone land. And I'm very, very grateful for folks like Kanwarpal who are doing incredible, incredible work alongside and led by the youth who are experts in their own experiences. And it's just wonderful to see them mobilize. So I'm going to turn to her, and she's going to share a little bit about what goes on in the RISE Center with regards to reframing domestic violence and dismantling the upstream determinants of those activities. Please come, Kanwarpal, it's all you.
Hi, everybody. Can you hear me?
Yes, thank you.
Okay. So I'm on video, but I don't know if it's better to stay off for sound.
You're good. I promise I'll let you know. I think it was an internet connection thing, so I think you're okay.
Got it.
Thank you.
All right. Just, you know, trying to help out where I can. Hello, everybody.
I love it.
You know, like, you know, tech is tech. We'll figure it out. It's really good to be here. Thank you for the invitation. As you can see, I wanted to start with some words directly from our young folks as we're talking about understanding, framing, and reframing structural determinants. So I'm going to read you these two quotes here. One is, realizing institutions don't work for you, but against you is the first step to healing your community. We know we can't run the city, it's too complex, but our experience and our voices should count, especially because we're the most affected. Next slide, please. Truths of our youth. My experience with violence is very brutal. I grew up with violence as if it were my sibling. Healing looks like education. If people understood their privilege and how their actions can deeply affect someone, I think that it would help a lot of people who are struggling with these issues. So those are just some summary quotes from some of our young folks. And I, you know, always need to also acknowledge and thank the young people who organized for this space we know as RISE, as Black and Brown young people, who really organized and took the risks and had the courage to name all sort of the dimensions of violence, to commit to ending it, to commit to making a space where they knew they would not actually directly benefit from the programs and services we have now. So it was 15 and 16 and 17-year-olds thinking about building legacy for their younger siblings and cousins, and the next generation. And I, as someone who's not a young person, am very humbled and grateful to be part of this space. And why I started with those quotes is because as we talk about the upstream determinants, what we experience as a service provider, a youth organization, a public health organization grounded in youth organizing, racial justice, is that, you know, and I say this to myself just as much as I'm saying this to all of this, is that we are completely deficient in understanding and addressing the ways in which violence impacts us. We, as researchers, policymakers, service providers, youth development workers, we still think violence is the exception. When our young people understand very clearly that violence is the engine of their lives, it is the engine of US nation building, it is not the exception, It is the pattern, not the outlier. But we still, in our work, and again, I'm saying this to myself just as much, we address violence as it is episodic, situational, individual, and even interpersonal. And what we at RISE have come to understand and articulate in our framework is that violence is structural, and all violence is state violence. So when we're talking about community violence, domestic violence, we have to understand that it actually, that the proximity of violence we experience with others is also proximate to the ways in which we understand US nation building. And that's could feel like a large leap. But again, this is lived experience that I don't think is just for our young people. I would assume and expect that many of us on this call might also be thinking about the ways in which the legacies of white supremacy, anti-Blackness, colonialism, imperialism, racialized capitalism create the situations and the conditions where the stress and the distress of what we're up against, we end up taking out on each other. And I feel like those quotes, to talk about violence as a sibling is to understand, and this was a learning for us, that there's an intimacy and a connection to violence. And if we're only addressing it in the way of how do we help young people get away from violence, but not acknowledge that when we break or rupture a relationship, so someone can be physically safe, there's still emotional loss. There's mental loss, right? And that we also are still stuck in a binary where some people are engaging in good behavior, some people in bad behavior, good coping, bad coping. For RISE, what we understand is it's all coping. And the risk of harm and violence is really based on our relationship to structural violence. That Black and brown children are over-surveilled, underserved, dehumanized, over-pathologized, criminalized, and killed by the state. And then are blamed for having feelings about it, are blamed for actually saying this hurts us when we see our community hurt. And I know I only have a few minutes, so that's why I'm saying what I'm saying with a lot of insistence and without a lot of soft landing, but our young people don't get soft landing either. And so if there's anything I can emphasize, encourage, insist on here is that we must shift to look at the structures and the systems that cause harm and violence, and that's all of us. And that we have to shift the focus from individual behavior change to shifting, disrupting, transforming, dreaming, and building the systems. And that can only be through building loving relationships with each other. I will stop there.
Honorable, thank you so much for that. And to your note about, sorry, I'm not going to give you a soft landing. Thank you. Don't. I want you to hold that mic like a grudge. And thank you too for ending with the suggestion or the invitation that we lead with love, right? I'll stop because I can go on all day long. But I'm very grateful for those words and those remarks. Thank you so much. We have on Team Kalhia, Teja Patabiraman is handling our social media, Q&A, chat function, all these kinds of things. So I wanted to touch base with her very quickly to see if there's any buzz that you want to lift up for us to address, just to get a little temperature check for all of our friends that are listening in.
Yeah, definitely. Thank you. And thank you to everyone for joining us today and participating in the conversation, both on Twitter and in the chat. So a few comments and questions that we wanted to uplift so far. Ty Parks asks, what are some successful non-carceral responses to domestic violence? David highlighted parenting education campaigns as a method of reframing and addressing family violence. And Lucia brought up the fact that while it's important to think about the role of parenting, it's also critical to take a life course approach. Then on Twitter, we have Krista and Christine tweeting and Calcasa. So thank you all for your engagement, and we want to keep hearing from you. So please continue to share your questions and reactions in the chat and on Twitter using the hashtag ReframeDV.
Thank you for that, Tasia. I had no idea how that was going to go, and it went wonderfully. I love it. And thank you for taking care of the chat. I can't find my glasses, everyone. So I'm just trying to make it work right now. So thank you for that. And thank you for engagement. Please, please keep it coming. Next, we're going to hear from Professor Michael Lenz. He's an associate professor of urban planning. Wait, I'm sorry, I don't want to mess that up. Urban planning and policy at the Luskin School at UCLA. And he's going to speak to us about his research on public policies that address housing market inequities and trying to dismantle all the negative outcomes of those policies that are disproportionately burdened by poor families. So please, Dr. Lenz, hit us up with your knowledge.
Thank you, Erin, and thank you, everybody, for joining us today. So, you know, as Erin mentioned, you know, my research and teaching and expertise is squarely in housing. And, you know, these days, I think a lot of us Californians in particular are experts on our housing affordability problem and our housing affordability crisis, right? And so I wanted to kind of shape some of that expertise that we all have with some of the data that I know fairly well, and kind of confirm, you know, some of what we're seeing out there. So, you know, what we're looking at here is severely rent-burdened households in the U.S., California, and LA County, you know, over the 17 years between 2000 and 2017. And, you know, basically what you're seeing around you in terms of increased homelessness, the difficulty of you and everybody else you know who's trying to find a place to rent, getting worse and worse, is certainly borne out by the data, right? You know, we know that housing has been getting more expensive, has always been expensive in California. It's always been expensive in coastal California in particular. But in recent years, it has become more and more expensive place for people to live. And so it's not our imagination. And, you know, we live in a very, very, you know, high income place in a lot of ways, a very hard charging economy in a lot of ways, at least before COVID. Yet this is a state with nearly 1 in 4 of America's homeless population living within it, right? And so we have this incredible wealth, we have this incredible possibility, and yet we have these very, very difficult, you know, wide-ranging housing affordability problems, not just at the very low income end of the spectrum, but into the middle class, into, you know, really compromising people's inability to afford anything else, right? And of course, this homelessness problem that has, you know, been, you know, with us for a long time, but is spiking, you know, very dramatically over recent years, is undoubtedly tied to our housing affordability crisis. And so, what are some of the reasons for this? There are many. It's a great place to live. People like to spend a lot of money to live here. But one cause is, as our population and our job numbers have grown over time, we haven't kept up with housing construction, right? So there are a lot of ways you can make housing more affordable. One of the ways is to make it more plentiful. And if you have very few options as a renter, if you have very few options as a potential home buyer, you're gonna have to spend more and more money on that housing, right? So, you know, we are, you know, one of the ways in which California has kind of dug itself in a very large hole has been this inability to build more housing. But there are, of course, many other ways that we can make make housing more affordable, right? Building more is essential, but we have to give people subsidies to afford rent. There's a lot of people that are not going to be able to afford the rent at any cost, and we don't do a very good job as a nation, and we don't supplement this as a state to assist people with affording housing, whether that's through things such as the housing voucher program or the construction of below market rate housing, right? That's something that we need to do much more of. And then a lot of our conversation has been, heightened certainly in COVID about how we protect renters when they fall behind on rent or are unable to pay, right? And so rent control, tenant protections such as eviction defense and, eviction moratoria are also very important to complement building more housing and giving people more money through subsidies. And, of course, I'm far from an expert on domestic violence or intimate partner violence, but there are some ways that we know that housing affordability links to these issues, these very important problems. Financial stress can exacerbate violence, perhaps. Housing precarity can make it harder for people to avoid, potential abusers and victimization. But police departments specifically often charge landlords if there are frequent 911 calls from their properties, which is an incentive for landlords to initiate or threaten evictions on tenants who call the police to protect themselves. So these things are intertwined in a lot of complicated ways, and I certainly thank you for allowing me to join the conversation.
Thank you so much, Mike. Thank you. Did I cut you off? No.
No.
Okay, beautiful. Thank you. And thank you for giving us that insight, because in this moment of COVID, we're dealing with new and compounded urgencies, right? If we're here in California, where it's already incredibly expensive across the state, and particularly in coastal cities where there would otherwise be some measure of resources that people could access, all of that is strained in this moment, and people are sheltering in place in what I think is a hostage situation. So we have a lot of work to do with respect to making sure financial security is something that everybody can access and maintain, because in large part, so many of the stresses and the precursors of interpersonal violence and community violence are tied to those sorts of just a lack of resources, honestly. So thank you so much for that. We're gonna switch gears and hear from John Finley. John Finley is a public policy associate at CalCASA, which is the California Coalition Against Sexual Assault. And he does wonderful work on strategic advocacy and helping to design all the ways that are needed to implement legislative policy. So he's going to speak to us a little bit about his work and how he and his team are working to dismantle these upstream determinants. John, please.
Good afternoon. Thank you so much for having me on this panel. It's quite an honor to be amongst these esteemed panelists, so many of whom whose work I've gotten the opportunity to work with at CalCASA, the California Coalition Against Sexual Assault. We use this data and this information that's gathered out in the research world, right? People who are studying these issues and problems and developing those solutions. We use that in our legislative advocacy, and when we're talking to senators like Senator Hurtado, bringing up seeking what true justice looks like. This is all so connected, but then also it's personal for me because when I was an undergrad in college, I got the opportunity to read so much of this work that my fellow panelists have put together, whether it's on housing or on gender equity, and it's such an honor to be here. My role at the California Coalition Against Sexual Assault is focused entirely around policy. And the way that we see policy is both in terms of legislation that's passed either at the local, statewide, or federal level, but also in terms of just how we leverage institutions to create change on behalf of large groups of people, right? On behalf of society as a whole, how we can transform our culture and change attitudes and behaviors on that community and institutions level, as opposed to just focusing on violence as individual acts or isolated incidents. I've heard so many of my fellow panelists talk about how we can't just focus on violence as individual things, but rather connected to systems, connected to institutions. And that's really the work of the California Coalition Against Sexual Assault. And we exist as a part of a larger movement, right? The movement to end sexual violence consists of rape crisis centers who are critical first responders within local communities to acts of sexual violence, domestic violence shelters, right, which are those safe places that people can go when they're victims of violence in the home or elsewhere. But then also campus activists. I came to this movement from the campus activist space. I was in student government at Stanford University. I was a junior in college when a student named Brock Turner raped a woman on campus at a fraternity party. And the movement came to pick me up. So it encompasses everyone and everywhere. And it's important that we all focus on what our role to end sexual and domestic violence can be. And promoting that is my life's work. And it's the work of so many people who are teaching me and working with survivors across the country and across the world to forge a better reality. Especially when it comes to public policy, one of the most important things for us to discuss and for us to understand is that our longtime response to the issues of domestic violence, interpersonal violence, sexual assault, our longtime response has been overly focused not just on response, right? Response, intervention, cleaning up the mess after an act of sexual assault or domestic violence happens, but also has been overly focused on criminalization and those carceral responses. We put a lot of needed effort into recognizing domestic violence in particular, but also sexual assault as actual crimes, right? Things that people are not supposed to do. That took a lot of work and activism on the part of individual activists, professors, et cetera, people really raising awareness that these are things that shouldn't happen or be normalized. But for a long time, we relied on the criminal legal system as our predominant way of getting that message across to people. And if there's one thing that we recognize today, right, but also that people have been saying for a long time, it's that that's going to be an insufficient and actively harmful solution to trying to end violence in communities. Not only does locking people up perpetuate cycles of violence in the community that they are removed from, but then also people are subjected to sexual and relationship violence while they're incarcerated, right? While they're detained, we know that the rates of sexual and relationship violence of people who are incarcerated are extremely high. We know that domestic violence is the leading cause of homelessness among women in California and also nationwide. And then people are subject to more abuse once they're on the streets. And when you add the coronavirus pandemic and the associated stay-at-home orders on top of these phenomena that are already going on, we know that people, and this is really the only thing we can do right now, right? This isn't meant to indict the state's response to the COVID pandemic, but we know that people are being confined to abusive households. We know that for many people, school or work or whatever it was their only escape from an environment where they were subject to constant abuse, whether that's from a partner or that could even be from a parent, from a family member. We know child sexual abuse rates are extremely high, and that every single thing that has gone on in this pandemic, whether it's rising unemployment or it's just rising stress and uncertainty, the financial impact of the pandemic, certainly, but also that emotional impact that some of my fellow panelists were talking about. These all increase the risk factors for relationship and sexual abuse. And every single one of those risk factors has been increased over the past several months. It's going to be a long time before we have appropriate data that'll tell us how to solve this problem or where it's even coming from. We know the rates for reporting this type of violence are extremely low compared to what we know is going on. People don't call the police when they've been sexually abused. People don't often call the police on their partner until it gets to a situation where it's absolutely out of hand, right? And we have known this for a long time, and yet we also know it's still happening. Senator Hurtado was talking about the importance of seeking true justice. We know that can't just come from criminalization. That misses so much, and the police miss so much of what's going on. I also see briefly in the chat, somebody mentioned that within law enforcement, there are high rates of domestic violence and sexual assault as well. And I want to name that that's also true. We see that in ICE detention centers as well. In our broken immigration system is rife with abuse towards women, abuse towards children, and abuse towards men, everybody. And these institutions are built on violence. And this is to say that we really need to invest as much effort as possible in preventing violence before it ever occurs. And so one of the most successful strategies that we can pursue is investing in those types of prevention programs and in the people who do this work successfully. There are people in communities who are running prevention programs, whether that's at schools, with youth groups, with specific cultural groups. There are so many folks who are experts in how to prevent violence and how to really change culture. That's the only way we're going to end these forms of violence in our communities. And the state meaning the state of California and also the United States of America, needs to invest actual dollars in making sure those programs are successful. One report that we released in 2018, The Cost and Consequences of Sexual Violence in California, detailed that when it comes to sexual assault, and the same is true for domestic violence and other forms of violence as well, we spend overwhelmingly more on response than we spend on prevention, to the tune of $140 billion in a snapshot of a single year. That is so much money to be spent on cleaning up a mess that didn't need to happen. That is so much money to be spent on an act of violence that should never have occurred. And the response is we're investing not very much at all in preventing violence on the front end. And that's an attitude that we have seen start to shift. I was pleased to hear Senator Hurtado mention she believes in prevention, and I think everybody on this call does. And so the task before us is to rally that cause and try to get more people to believe that this is violence that can be prevented. We can disrupt the stream of violence upstream, right? That's what we're talking about, before it gets to the point where folks are being murdered, where folks are being raped and they feel like they have no other option. And so that's the work that is before us and that we take on, and we're honored to be a part of this conversation and talk about how it can be strengthened and supported.
Thank you so much. That was beautiful. I'm so excited. I like how you started, John, saying the movement came to you, right? You got picked up and swept up in it. I love it. I have a really close friend, Elias Sewell at Emory University, and they said that justice work is the only site where there's zero unemployment, right? Everybody has a job to do. Everybody rolls up their sleeves and gets in there. And we see that today with Senator Hurtado and Anita and Kanwapar and John and Mike. That was really awesome. So before we jump into a little bit of a conversation, I want to check in with our rock star, Tasia, again. What's happening on the interwebs, Tasia?
Yeah, so the chat is really popping. People are talking a lot about the connections between housing and displacement and vulnerability and violence. Anna uplifted a New York Times article about how California's regulations have led to a very high cost to building. And I think that she dropped the link to that article in the chat, so you can check that out. Richard also mentioned the California's Domestic Violence Housing First program that the Blue Shield of California Foundation funded an evaluation of. And I guess that's a program which has been found to be effective in providing flexible assistance to help survivors avoid homelessness. So just kind of talking about that connection between violence and displacement and vulnerability. We also have some new followers on Twitter, Beverly, Najib, and Fresno Barrios Unidos. So thank you all for following us and staying engaged on Twitter too.
I love that. The family's growing. Look at all my new friends today. That's awesome. Thank you, Tasia. We only have a few minutes to hear from our brilliant panelists again. So I want to come back to Kalahia and Kalahia's aims, which again is to bridge research faculty in CSU, right, Cal State Universities, as well as the UC system, with the policymakers, with the practitioners, providers, legislators at the local and state level. And one of the questions we had thought about bringing to the discussion was for each panelist to think about what are the obstacles and challenges that they confront in their own work, right? We're all sort of in our different spaces and wearing our different hats. We're all rolled up our sleeves and are coming at this from different angles. So I invite all of the panelists, while you have this incredibly energized and committed audience in front of you, to share what are your challenges, what are your obstacles, and particularly around the ones that folks on this call might be able to engage in troubleshooting and problem solving with you. So I'll go first briefly. You know, as I mentioned, I'm a professor in the School of Social Welfare at UC Berkeley, and I work with students and colleagues who are very committed to social justice efforts in all different kinds of spheres: child welfare, gerontology and aging, undocumented policy work, immigration, all these kinds of things. So you name it, as far as the marginalization goes, our folks are on it. But I think about some of the challenges that I have as someone who wants to build research teams and research pipelines, right? Because this is the only spot with zero unemployment. And one of the challenges that I face is building meaningful, robust, collaborative partnerships with state agencies. And I think a lot of that is because scientists have historically, and still to this day, come into research sites and make a mess, you know, so trust has to be earned. It totally does. It goes both ways, and all research, you know, goes at the speed of collaboration. So that's something that I would really like to think through with my colleagues at the municipal and state level about what kinds of questions matter, right? What are the questions that they'd like for us in the research community to answer? How do they want to come about getting the responses that they need, and what do they want to do with that information? And having like a really healthy conversation around that from stakeholders who are all committed from their different sorts of domains and pockets of this work. So that's a challenge that I have that I'd like very much to address. And I'm going to turn to my panelists, you know, who I would love if they shared a little bit about some of the obstacles that they confront in their work and what might be done, or what can we think about before we hang up the call. So I'm going to start with Anita Raj. Are you there?
Can you hear me? I'm not going to come on video.
Perfectly, I hear you. Please.
Okay. Can you restate the question briefly again, just so I make sure I answer it correctly?
Yeah. What sorts of obstacles or challenges do you confront in your work and your efforts to dismantle these upstream precursors, influences, determinants of violence?
Yeah, you know, this is one that I have right now that I'm very cognizant of, because I'm originally from Mississippi. I was born and raised there, and, you know, now live in California, quite different political contexts. And I think that the nature of the political polarization that we see has really driven a wedge into what used to be something that didn't feel like political positioning of responses. It seems like there are these dividing lines that we don't have to help ensure change. So, for example, just the issue of violence, things like housing first. These are not the prevention aspects, but, you know, for the intervention, housing first, or financial inclusion efforts for women who are seeking to leave a difficult situation. But in terms of prevention, the notion of prevention activities in schools. These were things that there wasn't sort of a politicization of. I think to recognize the lack of utility of non-carceral, I mean, the carceral responses just simply aren't working. It's data driven. And I feel like the greatest struggle I'm having right now is really people valuing and using data for informed decision, or really questioning the utility of data, when I think it's important, whether you're talking about gathering and understanding qualitatively, quantitatively, that gaining an understanding from the populations affected. I mean, that's what data offer. And it shouldn't be viewed as something to be averse to or to question in the ways that I think where we've gotten. And I think that that's an area, this data-driven decision-making issue, I think it's a place where we need to really be moving change, because structural solutions are clearly required. There's not a question based on the data. So why aren't the data being used that way?
That's awesome. Thank you so much. I think about that too. data, or datum is the one data point. It's an observation. So what it looks like and what it communicates depends on the lens through which that observation was made. And so if you look this way, there's a whole lot going on this side you may not see, a whole lot going on this side you may not see. So data are wonderful, but they don't tell a full story, because people who collect data are only looking where they're looking. So we need to think about what gets left out of data as well, and what it means for our initiatives to be data driven. So thank you so much for that, Anita. I'm just gonna go in order. Kanwapra, what sorts of challenges or obstacles are you at RISE confronting that impede your good work, and what can we do about it in the next couple minutes?
Well, I think, the grappling with data, we're grappling with it. And as an organization that centers Black and Brown young people, honestly, we feel pretty handcuffed by conventional research, in that our funders, our policymakers, researchers, this incessant focus on sort of confounding and regressing factors to then create interventions that are apolitical, acontextual. So we live in intervention, prevention, postvention. Like, we're not living in one or the other. It's not like 8 to 12, this is our prevention time. And so I think that just the naivety and the oversimplicity that we have in trying to address and complicate these issues is the burden falls on our young people. And so what I want to say is, how do we have to conflate and relate in the data? That we actually have to bring and be explicit of the values, because we can look at data and it can be data driven, but if our values around that data aren't explicit, then we will be where we are. And so the same data can be used in spaces that can be used to, again, confine us, cage us, kill us. That same data can be used based on the values in places where we free each other and ourselves. And I think that's what is sort of really missing, is that sort of way in which we really oversimplify the issue to make it convenient for the systems to deal with it, versus how are we showing up for each other and ourselves. And so I would also say, for any funders, please do not force evidence-based practices in our proposals. Those are racist, those are classist. I don't know how else to say it. They are done out of context, and often, again, to pathologize Black and Brown and poor and queer folks in structurally vulnerable communities as the problem. The last thing I'll say is, how many words are we going to use until we actually just name it what it is, which is white supremacy and racialized capitalism?
Amen and ashe. Thank you so much for that. And thank you for also highlighting how data and evidence, need to be legible, right? These need to be written or communicated in a way that folks who enjoy privileges that we don't, the people we're fighting for, things that they can sort of metabolize, and what gets lost in that, and who should do the work of sort of stretching their imagination and stretching their literacy so that they will recognize, understand, and appreciate the kinds of stories that folks at RISE are telling, and the kinds of truths that folks at RISE are emphasizing. So thank you for that. We are just at about time, so I'm going to take liberty and ask that we go over a few more minutes, because I really still want to hear, of course, from Mike and John. So if anyone needs to log off, we get it. But otherwise, hang out with us. We're going to talk a little bit more. Mike, can you say a bit about what sorts of obstacles or challenges you're confronting in your work? And if they were addressed, how you could help save the world?
Well, I think, yeah, I mean, very quickly, I mean, two things certainly come to mind, based on, what we just heard, and kind of where I'm always sitting. So, we have in housing, we have like all of these short-term and long-term problems and solutions, and they don't know, and sometimes what you want to do to make housing more affordable and plentiful and available in the long run sometimes conflicts with how to make it more affordable in the short run, right? Like, building building a million housing units in coastal California isn't necessarily going to happen overnight, and it's not going to solve homelessness today, tomorrow, or even next year. So sometimes these kind of short and long-term tensions are really prevalent and make everything very challenging. The other piece, certainly reflects on what I can't help but to reflect on what we just heard. I mean, when we, if we deny evidence-based practices, if we deny research and data-driven ideas from certain places, then I don't know what we have. I don't know what we are able to hang our hat on and implement if we don't have it based on prior practice and kind of generalizable information. Now, I mean, I know there's tons of holes and there's tons of problems with some sources of data and information and evidence and the perspective that people have that's not centering, lived experience, for instance. But, I can't help but to push back on that idea a little bit.
That's fine. And this is why this is so important to, like I said, research, collaboration, all of that moves at the speed of trust. Like that's how research works. It's only going to move at the speed of collaboration, which also is about trust. And we can't engender that without being honest. So I appreciate that so much. And thinking about how to move from either or with our approaches to both and how to do that in a way that's holistic and that reflects and mimics the values that we say we have, Thank you for that. John, can you tell us how we can help CalCasa get it done?
Of course. In policy work, a lot of things come down to money. You can't really do things in a capital. I mean, somebody else said it much more eloquently than me, talking about racialized capitalism. You can't really do things without money in the society that we have. And so many of our policy focuses, I would say, need to be more around developing resources and getting resources to communities rather than passing new laws a lot of the time, honestly. I remember there was a quote from one of Governor Brown's veto messages where he said the California Penal Code already covers every conceivable form of human misbehavior. It's time to stop adding things to the penal code. And instead, what we actually need are to invest resources in communities and in people. And I want to echo what Anita said as well. Our biggest challenge that we see is the politicization of our issue. And that's certainly always been an obstacle. I think throughout history and throughout society, you see examples of people using sexual violence or violence against women and children as a kind of prop, as a kind of political football, as in we want to get this thing done, and therefore we're going to say that these people, these undesirable people, are attacking our women and children. I mean, we've seen that before. We've seen that as justification for lynching Black people in the South, and we've seen it, time and time again. Whether it's this most recent iteration of the United States, basically saying that coming across our southern border are a bunch of rapists and criminals. That has always been something that's with us, but it's become really bad, I'll say. Things that didn't used to be partisan have become partisan. The Violence Against Women Act was always a bipartisan bill, and just recently, the version that passed the House of Representatives is sitting dead in the United States Senate because the Republicans will not take it up. That's not normal. That didn't used to happen with this issue, and it happened because the National Rifle Association came out against the Violence Against Women Act reauthorization. There was a bill that just was signed here in California, Senate Bill 145, that this bill actually doesn't really do anything that substantive. All it does is it establishes that in California, we will treat gay and queer sex offenders exactly the way we treat straight sex offenders, which is that they go before a judge to see, and the judge uses their appropriate discretion to determine whether lifetime registry on the sex offender registry is appropriate for that particular case. That has blown up to be one of the most hotly discussed and contentious bills that's ever been passed in California. And honestly, you know, we supported that bill, but it's not even that transformative. It doesn't remove people off of the registry, really. There are the impact of it is going to be there are a few less young queer people who will be criminalized for the rest of their lives for making a mistake when they were young or for engaging in consensual sex when they were young. And yet that has been blown up and turned into this partisan back and forth, and so much misinformation, particularly coming from social media, people saying that California is legalizing pedophilia now. I mean, it's ridiculous. It's not what the bill does. And it's certainly not anybody's goal or intention to do that. And so the politicization is a really big problem, and we really need to encourage folks to look at this issue as a community problem that needs to be solved, and not something for us to score political points on. And not something for us to, you know, run our ridiculous campaigns on these days. I mean, it's completely absurd to say that California is trying to legalize pedophilia. And I just, before we left, I had to say that because I've had to deal with it a lot the past couple of days.
Yeah, I'm like, who's saying that?
Everybody.
Yeah, I'm like, who said that? Thank you. So John needs money, and he needs people to do the reading. So get on that. Before we head out, I just want to thank everyone, the panelists, the Calahia team, Senator Hurtado for joining us, and to help us, and for helping us think through our values. Really, that's what I was hearing for the most part. There's a lot of conversation and sound bites and pundits and talking heads, especially in the world of Zoom, who have a lot to say about what's right and where we should be headed. But the actions and policies that follow don't necessarily reflect those promises. They don't necessarily reflect those agendas. And so we have to hold one another accountable and think about how folks who are so surveyed, you know, whether Child Protective Services, who's coming in and out of the women's shelter, who is caught up with a conviction and a charge and this and that complicates their lives in all these kinds of ways, what registries, this, that. We have so much tracking, but at the same time, these very subjects or communities or pockets are deeply invisibilized, and it's a very sinister irony that needs addressing. So I'm very, very grateful to everyone in the chat, in the Q&A, engaging on social media, you know, putting their feet to the fire, and just making sure we're doing this work in community, because it's exhausting, but it's necessary. And so we have to lift each other up. So I'm gonna sign off with deep gratitude and a bunch of homework to do, and with great expectation of seeing you all in the future again. Thanks, everybody.